Our healthcare delivery system is in drastic need of capital programming to support our ability to transform and continue to expand our access, to address racial disparities, and move forth the health status improvement of our citizens across the state. A perfect example of this is our hospital, Touche Regional Hospital, which is located in greater East St. Louis, physically located in a community called Centerville. Centerville happens to be the most impoverished community in our state and in our nation. Our patients include 11% who are uninsured, 65% that are Medicaid. It's a hospital that partners with our FQHC, SIHF Healthcare, to expand access to primary care, dental, behavioral health specialists, and ambulatory services. It is a true safety network for health for our vulnerable patients. Our hospitals, our safety net hospitals, face great challenges, financial challenges, due to the significant underserved, uninsured, and Medicaid patients we serve. Those financial challenges often limit our access to capital markets for construction, expansion, and equipment upgrades. We represent health centers across the state of Illinois who are critical delivery aspects to our healthcare delivery system for vulnerable patients, impoverished patients. But our safety net hospitals and our community health centers across the state do not have the resources to make capital improvements to transform our delivery systems to address the breadth of healthcare needs that exist today. Needs such as facility expansions, equipment deployment, telemedicine, behavioral health integration, substance abuse treatment. We cannot do this unless the state enacts a capital program that includes health care. That is why today we are urging the Governor and General Assembly to invest in health care as part of the capital program so we can continue to improve the health of the most vulnerable patients in urban and rural areas, and so we can strengthen the economic health of our impoverished communities by creating jobs that can build a workforce for tomorrow that can continue to build our economy and sustain growth towards better health in our areas.
As a safety net hospital, Touche provides much needed healthcare services to my community, regardless of race or socioeconomic status. Touche also partners with community health centers to provide medical care, behavioral health care, dental care, and other much needed services that help improve health outcomes while lowering the cost to the state. The people in my district should not be forced to travel great distances or receive any less quality of care simply because they are not rich. It is high time that the state stops disinvesting or de-investing in these communities and start reinvesting.
It's high time the state of Illinois begins to invest, just as the representative said. No more divesting should be allowed for safety net hospitals. Rather than divest, we need to invest in safety net hospitals. But there's no reason that any other citizen should be denied the health care access to how much money they make or where they live. It's just not right. It's not where we should be as a state. I always find myself here in the last few weeks of session tired, but ready to fight. We're in Springfield here with our associates and our great elected officials to continue that fight, to make sure that the money goes to communities like Roseland on the greater far side of Chicago.
And so when you think about what's going on with this capital bill, it's important to invest in a lot of the data and research in regards to where we're taking our economy. 400 people are employed by Roseland Hospital in a concerned era now where we're looking at cutting jobs, job opportunities being decreased. We certainly want to keep intact a lot of our anchor institutions that do hire and have employment at a high clip. What we're doing with this capital bill is being able to increase that and bring more jobs to the community. And
I believe we will get this capital plan done. We haven't done one since 2009 when I first was elected into the General Assembly. and it's well needed that we get one done. As Tim stated, these last 4 years has been kind of, a challenge for safety net hospitals and even regular hospitals throughout the state. This whole state has been held hostage, and it's time that we move forward. And I believe the General Assembly will come together along with the governor and make this happen.
And we stand here today in strong support of including vertical projects in a capital bill and are proposing a $125 million investment in health centers to build new sites, upgrade current facilities, and purchase medical equipment to expand access to care in underserved communities. In fact, Illinois health centers save the state 27% per Medicaid patient. And in terms of financial health and stability, community health centers are major employers and buyers of goods and services within their communities, delivering an economic impact exceeding $2.4 billion on an annual basis. So as the Governor and General Assembly consider a capital bill, vertical projects must be included to further transform our healthcare delivery system. And specifically, an investment in community health centers will deliver long-term value and will undoubtedly have a positive impact on the physical, mental, and economic health of our state.